Welcome to the e-learning course for the iFightDepression tool. In 4 modules, we will present you with the self-management program, iFightDepression. The program was designed for people with mild to moderate forms of depression. After completion of this e-learning course, you will be able to regularly use this tool in your daily practice as a complement to the regular treatment you offer. The iFightDepression tool is intended for adults and adolescents with mild forms of depression. iFightDepression and its corresponding website are coordinated and disseminated by the European Alliance Against Depression. iFightDepression is currently available in 11 languages. Before we discuss the content and aims of this e-learning course, I would like to say a few words about the iFightDepression tool. The tool is a guided online self-management program for people with mild to moderate and subclinical forms of depression. It is based on the principles of cognitive behavioral therapy. The tool can support regular treatment, for example, to bridge the waiting times necessary to see a therapist, for early intervention, or for the prevention of severe depression. There are several things to keep in mind about the iFightDepression tool. First, it is a self-management instrument which is intended to strengthen and activate the already existing self-management strategies of patients with mild forms of depression. The tool is to be offered in addition to the treatment which you would normally provide and should not stand alone. The tool is not meant to replace psychotherapeutic or medical treatment. The tool is a guided program, which means that you support your patients while they use the tool. We would also like to point out that in the course of using the iFightDepression tool, some patients may experience a deterioration in their depression symptoms. Although this is not likely to happen, if a patient does deteriorate considerably or develops suicidal thoughts or behaviors, please initiate the appropriate care. I would like to say a few words about the structure of this course. Upon completion of this e-learning course, you will be familiar with the iFightDepression tool and how to use it in your daily practice with patients who have mild forms of depression. There will be 4 lessons in this e-learning course. In Lesson 1, you will be refreshed on some basic information about depression. In Lesson 2, you will be provided with a general introduction to the tool. In Lesson 3, there will be a guided online tour through the tool. You will be introduced to each of the patient workshops within the tool, as well as the iFightDepression version for adolescents and young adults. In the final lesson, you will learn how to incorporate the iFightDepression tool into your daily practice. You have reached the end of the introduction and are now ready to start Lesson 1. Welcome to Lesson 1, Depression, Basic Knowledge. Lesson 1 consists of background information about depression, including its symptoms and treatment. Studies of depression indicate that mild depression is not a mild disorder. Patients suffering from mild depression are at risk of deteriorating. Mild depression is also associated with profound suffering, suicide risk, and reduced life expectancy. Patients with mild depression therefore require specialized care. However, the more people with depression seek help, the more demands are placed upon the healthcare system. Access to specialized care therefore often involves long waiting times, sometimes referred to as a bottleneck of access. As a result, waiting lists for psychiatrists and psychotherapists are getting longer and longer. In this context, support for self-management activities is increasingly important to bridge waiting times or to prevent transitions from mild to more severe forms of depression. It is this gap that the iFightDepression tool fills. The tool can help prevent patients' symptoms from becoming worse, as well as bridge waiting times to specialized care. In order to meet diagnostic criteria for a depressive episode, at least 2 core and 2 secondary criteria must have been present for a minimum of 2 weeks. The secondary criteria will be displayed in the gray circle, while the core symptoms will be displayed in the white circle. The core symptoms are depressed mood, loss of interest and pleasure, decreased energy. The secondary criteria include psychomotor agitation or retardation, change in appetite, for which many patients present as weight loss, reduced capacity for enjoyment and interest, diminished ability to concentrate or indecisiveness, sleep disturbances, unreasonable feelings of self-reproach and guilt, thoughts of death, suicide, or suicidal behavior, and loss of confidence and self-esteem. In primary care, patients with depression often present with a range of somatic symptoms. These complaints include headaches, back pain, exhaustion, tension, abdominal complaints, palpitations, tinnitus, sleeping problems, stomach problems, dizziness, and other physical complaints. Patients often present with somatic symptoms because depression is often associated with somatic complaints. Already existing somatic complaints, such as lower back pain, tinnitus, or others, become unbearable in the context of depression. Tinnitus, for example, which is well tolerated by most patients, may become not louder but unbearable in the context of depression. Patients might ask you, what are the causes for my depression? To explain the causes, both psychosocial and biological aspects should be taken into consideration. The metaphor of a coin helps to prevent either-or thinking. The figure shows that both psychosocial and biological aspects contribute to the development of depression. These two aspects are not contradictory, but complementary, like two sides of a coin. On both sides, there are factors which can increase a person's vulnerability, such as negative life experiences and genetic factors. Triggers, such as stressful life events or events which others might consider to be positive, or hyperactivity of the stress response system can lead to the onset of depression. Because both sides contribute to the development of depression, there are treatment options for each, namely psychotherapy and pharmacotherapy. There are two common treatment options for depression. Pharmacotherapy treatments typically involve antidepressants and mood stabilizers. Cognitive behavioral therapy is an evidence-based psychotherapy for the treatment of depression. There are additional treatments for depression, including light therapy for patients with seasonal affective disorders, sleep deprivation, which is mainly provided as an inpatient treatment in some countries, electroconvulsive therapy for patients with severe and treatment-resistant affective disorders and delusional depression. Furthermore, there are complementary measures such as self-management activities, including exercise and others. The iFightDepression tool is not a treatment in the traditional sense, but a self-management tool. In the next lesson, you will get to know this tool better, which can be used in addition to the care you already provide patients who suffer from mild forms of depression. You have now reached the end of Lesson 1.